Morning, everyone. Thank you for joining us. I look forward to this particular webinar. Debbie has done an amazing job in putting it together. And so let me introduce the team. I am the division director and have been with PHI for a long time, but with the Center for Immigrant and Refugee Health. Like most of us, we're all kind of new. I've been here about 6 months now. Our advisory group associate is Sarah Lackey, and Sarah will introduce you to some of her work in the next few slides. But she is our guru right now, putting together our conference that you'll also hear about soon. Debbie Disagun, as I mentioned, she's our research associate 3 and has been an instrumental part in getting our Smartsheet up and running. And then also, last but not least, is Harshi Nirala. She has been also very helpful in getting our Smartsheet details up and running, and she's our research associate 1. Yeah, so this is our stellar team. Thank you. Also, to let you know, and this is where we'll talk about a little bit more detail, and if you've been in a previous webinar, you'll also have heard about this. Sarah is very instrumental in putting together our Communities of Practice Advisory Group. This group meets quarterly where there will be, or there have been special presentations, very relevant, germane to the work that we're doing here, doing a lot of capacity building for our partners. And now that we've got a lot more partners, this will be a really great time to share best practices, share resources. Also, we will be putting on office hours every month where people can come, just drop in, listen to other people's questions or come with your own questions. If you happen to send those in advance, if they're complicated questions, that will be helpful to all. But either way, we will get you the answers to questions you have. And then, much like today, Debbie is going to be the lead for our technical assistance on our reporting, on Smartsheet, on those details and nuances of what we're asking of you. And please, just a side note, everything we're asking of you is because we're required to report back to our funders. So while this may seem a little bit detailed, really we're trying to satisfy our funders, and we are here to help and support you in getting this data that we'll be asking of you. So I believe we've got one more slide.
Yeah, I'm trying to move it over. Oh, there you go.
All right. And then just for any questions you might have, please reach out. We have our own special email, MER, which is Monitoring, Evaluation, and Reporting. And we strive to answer your questions as soon as possible. So please keep that in your back pocket. And I'm going to turn it back over to you, Debbie. Thank you.
Great. Thanks, Dr. Marta. Yes, and we will be providing again the recording of this training along with the slides afterwards. So don't want anyone to be rushing with like virtual or like handwritten note taking. So we'll provide all of these tools afterwards. And we recognize we're going to be kind of throwing and pouring a lot of information about data and reporting to you all today, but rest assured you're not going to be alone in this process, as Dr. Marta has shared. So specifically for reporting guidance, I wanted to share that we have a toolbox. You can call it like your lifelines for reporting to us. So definitely one, you're going to have the training recording afterwards. Second, we're going to go over there's a few progress report planning and preparation forms and templates that'll help you and your team track and monitor and take tabs of the data before it's entered into Smartsheet. So there's going to be a lot of roadmaps and checklists that is optional for you to use to help you prepare for the data. The third is also Dr. Marta has shared is that we'll have monthly office hours. So you can drop in and ask any questions, or you can just sit in and listen in to other folks' questions. So that's another way if you have any reporting issues or concerns or questions. And then, of course, call us anytime. We're very friendly and accessible. You have our email, our telephone, number. We can hop on a Zoom if you need to troubleshoot anything on the portal. And I know for those of you who have fully executed contracts already, some of you have contacted me to help you with that. That's always going to be ongoing, and we're here to help and support you in this process. Okay, so what is Smartsheet? I wanted to just start off with that because I know there was a lot of questions about this during the orientation last month, and I just wanted to check in, maybe show of hands, or on the chat box. Are any of the organizations here already using a Smartsheet? Just curious. And if I don't hear anything, I'm going to assume that's a no. Okay, so I see a yes. Okay, wonderful. Two yeses. Yeah, so for those of you who are not familiar with Smartsheet, it's basically a cloud-based online software program. You can think of it as like a kind of a data management platform. You'll see different versions of it when we open it up today for the instructions. So, but there's many uh, features on it that you can use for reporting, for data entry. It almost just looks like a cloud-based, Excel file. For reporting and for data participant collection, it's going to be accessible to you with a link, and we will provide this link after today's training. So I'm going to go over the two main uses of Smartsheet for you, the subgrantees. And the first one is for progress report submissions. And there's two types of progress report submissions. There's a semi-annual progress report, which we call like the long report, and your invoices. And then you're also going to use it for your quarterly progress report and invoices. And the quarterly progress reports are just shorter. And we'll go over this much slowly. But just wanted to point out that the semi-annual progress report includes total summary numbers, and also there'll be open-ended questions. And also we'll need the summary report for participant assessment questionnaire. We'll go through all of this, but I wanted to give you guys a big picture. For the quarterly progress report, which is shorter, it's mainly going to be numbers. This is a sneak peek of the Smartsheet reporting portal. And I'll actually open this up live, but I just wanted to give you a view of it right now. So it almost looks like an application. You'll be inputting numbers and data into fields. The second use for Smartsheet for you, the subgrantees, is for participant data collection. So this is going to be also used for storing individual level demographic and programmatic data. It's to be accessed and overseen by you guys. No one should have access to that, but you should be able to grant us and our CDSS access to this sheet in the event of a request to see the data, or in the event of an audit. And we'll go through this very slowly, but wanted to give you the big picture. This is, again, the sneak peek. Again, it looks like an Excel sheet, but this is a Smartsheet form where you will be entering the individual level data per participant, whether they're a student, a family member participant, or a staff member who's participated in service provider capacity types of activities. So I just wanted to give you a sneak peek. Those are the two main purposes that the subgrantees will be using Smartsheet for. And here it again is as a summary, so you see it as side by side. So again, the requirement for Smartsheet for the report submissions, that's going to be accessible via link. There's no login or password for it. So when we provide you the link shortly after today's training, you could go ahead and click on it, play around with it, just get a feel for it. So there's no login or password for report submissions, and that's accessible, year round. Whereas the Smartsheet link that you'll be using to enter in your participant data, because of the highly sensitive information that will be entered in that specific platform, there will definitely be a login and password for the authorized users for that. And we will provide all that information once you have a fully executed contract, there'll be steps on how to access that and so forth, and how to navigate that particular Smartsheet portal. So on the left, I just kind of repasted the requirements for Smartsheet, where again, we're using that for report submissions, semi-annual and quarterly reports, and also for your participant data. But if your organization has other types of data management systems, we ask that they are confidential and very secure types of systems, and that's okay. So it could be that you're using Salesforce for case management notes, or another type of software, or you might have physical case files for your participants for note taking, or a binder to place other types of documents. That's fine, but we ask um, that these are also that these systems are secure, meaning that they're kept in any type of physical type of profile information on the participant be kept in a locked storage. Any types of online software must have a strong password, limited user access. Participant data should have anonymous identifiers, and a data backup plan for all these extra systems that you may be using. And we only highlight this because of all the sensitive information that you'll be collecting on those participants. So we're still in part A. We've gone over the big picture uses for Smartsheet. I wanted to hone in here on the two types of progress report submissions. Again, we have a long report and then we have like a short report. Um, and for the long report, it includes both numbers and open-ended questions. And there's going to be two links for that. One for kind of the main report about participant numbers and questions about progress and accomplishments and success stories. And then the other link will be a form to enter in the total sums from the participant assessment form. And we'll talk about that later. The quarterly progress report is shorter. It's like actually a subset. It's a slice of the semi-annual report. So it includes mainly quantitative data. There might be one or two short answers, but it's just a piece of the semi-annual report. So after that main part of this semi-annual report, there is a second link, and this is just for the semi-annual report. And this is why it's called a long. We know it's a very long report. There'll be a separate link where you will need to enter in the total sums from the participant assessment questionnaire. And what that is, and we'll provide all of this information after the training. It's an 18 question participant form. No, it sounds long, but it's mostly multiple choice and maybe like one or two open-ended questions that we ask you to administer this to your participants 1 month before the semi-annual report due dates. And the purpose of the assessment questionnaire is really to get like self-reported, perceived outcomes from their point of view. And some of the areas that we're asking about, it's perceived improvement in navigating, the healthcare and other social services systems, understanding and knowledge of English. Is there a reduction in barriers? And other questions about service utilization. We have these available in English, Dari Pashto, Ukrainian, and Russian. We'll provide this for you so you can administer these 1 month before the semi-annual report due date. And let me just show you how that would look. So you're only going to administer this to participants wherever they are in the program. So so this one, it's not going to be applicable because it's too early. So you're not going to administer this questionnaire to your participants anytime soon. But for the next semi-annual progress report, which is due March 10, 2025, we ask you about a month to go ahead and administer it to your participants so you have time to collect the data and report those total sums via Smartsheet. And how it will look like, it's going to look very similar to the Smartsheet reporting a portal, except that this one will be titled the Semi-Annual Participant Assessment Sums. And this is just a sneak peek. Say, for example, from question 3 on that report, we only want the total sum number. So for this specific question on the assessment questionnaire, have the barriers you face in accessing basic needs reduced since participating in the program? We want to know the total number of participants who reported yes, no, they don't know, or they refused to respond. So again, we only want the total numbers for each of those questions. So we ask that you tally all of it so that you can enter in those total sums on this part of the report. Okay, I know we're still in part B. What we just did is we went through the instruction for submitting a semi-annual report, the long report on Smartsheet. So that is the first use for Smartsheet. I'm happy now to hand it over to Harshi, who we're going to shift gears here so she can show you the instructions for how to collect participant data and store that onto Smartsheet as well.
Thank you so much, Debbie. And I know that there's more Smartsheet information. I'm sorry, but this will be pretty quick. This is just essentially to help you understand and understand what you'll be collecting and how you'll be collecting it, where you'll be collecting it. So we will be providing you a licensed user access to having your own Smartsheet folder and your Smartsheet spreadsheet where you'll be collecting individual participant data for each participant in your program. And you'll be receiving this once your contract is fully executed. This will be given only authorized subgrantees should be having access to this Smartsheet because it will be containing highly confidential data and it shouldn't be shared with really anyone other than the people who will be working on that Smartsheet and putting any data and the person who has access to it, except when if you're under audit or during site visits, you can just pull it up and we will take a look at it. But other than that, you should not be giving access to this to anybody. I'm gonna go over just kind of quickly what will be there, and then I want to kind of do a live demonstration of what inputting that would look like so that it feels a bit more accessible once you get your access to the Smartsheet. So some of what you'll be collecting will be the participant name, their status, their alien number, and if you have any way to identify them, a unique ID that you give them, you can put that there as well. Again, as you see, there's highly sensitive data, and which is why we ask that you don't share this with anyone, such as their entry status, where they're from, their country of origin, their gender, their date of arrival, etc. We also have their eligibility, whether or not you were provided with eligibility documentation, and just staff members, one of your staff member attests that they have received it. We will also be giving out, or we will also be requiring that you check that you give them information on what data will be collected from them so that they're made aware of that. And again, attestation for that. We also ask that you have entry and exit dates and the type of program that they're participating in. These slides will again be available after, and also we will be providing sort of detailed information on this after as well. I know it can be a lot, but don't worry about all of that. We'll provide more information as well. Debbie, if you could open the Smartsheet and I will sort of go over that quickly. This is the program services and activities by category will also be on there. It's just whether or not you're providing this service and what dates you provided them, which date each participant accessed these services.
Okay, I'm going to stop sharing here real quick and then pull up.
Yes.
Okay.
I know I went through that really quickly, but I think when I go over it with the Smartsheet in front of me, it'll be fairly digestible. I hope so. And I know it's a lot, but it's pretty easy, and I think you'll be able to. I also recommend that once you get access to this, you sort of look around and click on it as you, before you even start collecting the data or before you input any data, just to sort of get an understanding of what it looks like while you're physically on the Smartsheet. So this is what it will look like. You will be given, we will make this for you and send it over so that you don't have to worry about all the formulas and everything. I also have 3 entries just so that you see what it looks like. I'm going to go over each one of them really quickly. So as you see, you have the information in the pinkish red is just about, this part is the item that we think is highly sensitive, but all of this is highly sensitive. So just be aware of that. It's the alien number, the participant name, the status. As you can see, Miss Taylor Swift as a student, is receiving services at your CBO as a student. And so a lot of these have drop-down menus. So participant status, you can drop down, click what type of participant they are. And then moving over to entry status, this is also as a drop-down. You are able to click what their entry status is. And if it's not, you put in the next column, you would put in what their entry status is, their country of origin, and if it's not the ones that we've listed in the drop down, you'll have the ability to do that, their gender, their date of birth, their grade level, their date of arrival, participant, whether or not they've been here for more than 12 months. And then the informational handout, which I mentioned, is it's whether or not they were made aware of the data that they'll be collecting and whether or not they've affirmed that they've understood that. And then your staff member, employee of the month, Britney Spears, collected that information. And so she attests to that right there. And also collecting the eligibility for that. Actually, Debbie, if you can go all the way back to the beginning, I want to show a way that you can actually document the actual eligibility on there. As you can see, there's a little bit of there's a attachment icon. If you click on that, you'll have the ability. I put in a little image of a passport because I was having fun. You can add an image, you can add a PDF, you can add any type of a file. And it's as simple as like a couple of clicks, as Debbie just showed. So you can document that there. You don't have to, but if it's better to have everything in one area. So yeah, that's just a quick little sidebar. And then which program that they're in. So if it's RC, S2S, or ERC, they have the ability to do that. You have the ability to put that in there, and then the dates that they've entered into the program. I've just put 2 random dates, unless you really are servicing Taylor Swift, which will be really cool. And program activities. So this is the one where you put in whether or not they've received or they've attended that and received services and what dates that they've received it. So as you can click open it and then add all of the dates that they've access to these services, and it goes on for as many services that you provide. And if you don't, you can just click no and then leave blank. I can also do what it looks like when you are providing services for staff members. If you are participating in the last category, which is providing services for staff members and capacity, that you would leave a lot of the sort of spaces here blank because they're staff members, so a lot of this isn't applicable. You can just gray it out. You can leave it empty. Up to you. All of that would essentially be blank, and then you would just put in when they've accessed that service. As you can see right there, and then you would just put yes, and that is if that is part of your work plan. Also wanted to quickly show what it looks like for a family member. It's pretty much the same as a student, except you would obviously click the family member one, and then you would you would make sure that when you are putting in the eligibility, you would put in that it is a student, that it is that they are the relative of a student, and that they that you received the eligibility of that student as well, and then what that looks like. I know I went through that pretty quickly, but once you get onto the Smartsheet and start looking around and reading through everything, hopefully it'll become easier. But if there are any other questions, you can always reach out to us over at the MER team, and we would be happy to walk you through anything. We will also be providing a bit more of details along when we provide the licenses for you, so that you're not opening that Smartsheet blind. I know what that feels like. So yeah, that's about what I have for the Smartsheet for individual or participant data collection. I'm going to turn it over to Sarah, or I'm going to turn it over to Debbie actually for the Q&A or any questions that you might have.
Yeah, thank you so much, Harshi, for that component, for the second use for Smartsheet. Everyone, we know that this is a lot of information. We acknowledge, could feel a bit overwhelming, but as mentioned, we're here to support you in the process. And based on other, awardees who have used this before, it just seemed a little daunting, like from the training today. But once you're on the platforms for reporting and data collection and get a feel for it feels much more accessible and usable. So we just wanted to assure you that it's pretty user friendly, and then we're friendly as well as human beings. And so we're here to support and help you in this process. So at this time, we have really we're perfect on time. It is 12:05, and we have 25 minutes that I wrote down for Q&A and announcements. So just wanted to open it up for questions. You could raise your hand, say it out loud, or put in the chat box. So there is a question about if it is required that wasn't cleared for Smartsheet for the participant, the individual level data. And the reason that we ask that it is a required uh, piece in working with us is it really helps streamline in the event that PHI or CDSS does an audit and needs access to these files. It makes it a very seamless process if everyone has the Smartsheet and all the information is gathered in one place for them to have access to that. So at this time, yes, we're asking that this is a requirement to use Smartsheet for the participant level, the individual level data.
And regarding the question about when does the data need to be entered, it's really up to your team, but it would be easier if you do that more consistently after services are implemented. In the case that there's ad hoc requests for data to be submitted to us and then back to our vendor, we suggest that you do that, frequently and consistently, just to make it easier on your team.